Hello, my name is James DeBelka, and this is my presentation on the effects of alcohol on you. Immediate effects of alcohol on the brain. Alcohol can cause many immediate issues neurologically, including difficulty walking, blurred vision, slurred speech, slow reaction times, or impaired memory. The National Institute of Alcohol Abuse and Alcoholism, or NIAAA, found that alcohol can produce detectable impairments in memory after only a few drinks, and as the amount of alcohol increases, so does the degree of impairment. Large quantities of alcohol, especially when consumed quickly and on an empty stomach, can produce a blackout. People who have been drinking large amounts of alcohol for long periods of time run the risk of developing serious and persistent changes in the brain. Damage may be a result of direct effects of alcohol on the brain or may result indirectly. Studies also showed that both men and women have similar learning and memory problems as a result of heavy drinking. The difference is that alcoholic women reported that they had been drinking excessively for only about half as long as alcoholic men. This indicates that women's brains, like their other organs, are more vulnerable to alcohol-induced damage than men's. Drinking during pregnancy can lead to several physical, learning, and behavioral effects in children, the most serious of which is a collection of symptoms known as fetal alcohol syndrome, or FAS. Children with FAS may have distinct facial features, infants may be smaller than average, their brains may have less volume, and they have fewer number of brain cells or fewer neurons that are able to function correctly, leading to long-term problems in learning and behavior. Alcoholism over a long period of time can greatly affect the heart and its long-term health. This can include cardiomyopathy, stretching or drooping of the heart muscles, irregular heartbeat, increased risk of stroke, or increased risk of high blood pressure. Alcoholism over a long period of time can greatly affect the liver and its long-term health. This can include steatosis or a fatty liver, alcoholic hepatitis, fibrosis, or cirrhosis. Pancreatitis is a dangerous inflammation and swelling of blood vessels in the pancreas that prevents proper digestion. Alcohol causes the pancreas to produce toxic substances that can eventually lead to pancreatitis. Chronic drinkers are more liable to contract diseases like pneumonia and tuberculosis, as drinking too much can weaken your immune system, making your body a much easier target for disease. Even up to 24 hours after getting drunk, drinking a lot on a single occasion slows your body's ability to ward off infections. Based on extensive reviews of research studies, there's a strong scientific consensus of association between alcohol drinking and several types of cancer. These can include head and neck cancer, esophageal cancer, liver cancer, breast cancer, or colorectal cancer. Alcohol may encourage aggression or violence by disrupting normal brain function. Alcohol weakens the brain's mechanisms that normally restrain impulsive behaviors, including inappropriate aggression. By impairing information processing, alcohol can also lead a person to misjudge social cues, thereby overreacting to a perceived threat. Simultaneously, a narrowing of attention may lead to an inaccurate assessment of the future risks of acting on an immediate violent impulse. Alcohol can affect many parts of what our brains do while we're driving. Firstly, the brain's ability to divide its attention. Normally, when a person drives, their attention is split between, for example, staying in the lane and following road signs. However, when impaired, the brain may struggle to divide its attention, resulting in potentially poor outcomes. Second is the brain's vigilance or alertness. When impaired, the brain may struggle to remain alert. This can become evident at a blood alcohol content, or BAC, of just 0.03. Third is the brain's ability to track objects. This can include things such as pedestrians, cyclists, other cars, or the car that is being driven. Tracking impairment can be observed at a BAC of 0.0018. Perception is the brain's ability to make connections between information it gathers and ideas associated with them. For example, if a ball rolls into the street, without perception, the brain would think that the ball is harmless. However, in fact, a ball rolling into the street can be associated with children and therefore should be taken more seriously. Reaction time is how fast the brain can take in information and react to it. If a person were to jump into the road, if the brain had enough time to react, then the driver would be able to stop the car and avoid colliding with said person. However, when the brain is impaired, reaction time is slowed and there may not be enough time for it to react. This can take place at a BAC of 0.02. Vision, obviously, is the brain's ability to take in visual cues. Alcohol-based vision impairment can take place at a BAC of 0.03. Psychomotor skills are the brain's ability to operate parts of our bodies, such as our arms or hands. For example, when making a turn, it is necessary to turn the wheel, press the brake, press the gas, turn on the blinker, and potentially change gears. Psychomotor impairment can take place at a BAC level of 0.04. Drowsiness is a special case since it is not possible to measure it. However, alcohol can make a person fall asleep much faster, and since drowsiness at the wheel is a problem for sober people, coupled with the fact that most people are drinking at night, it is a fair assumption that impaired drivers are put at a much greater risk. This can take place at a BAC level of 0.01. Behavioral treatments are led by health professionals and supported by studies showing that they can be beneficial. They are aimed at changing drinking behavior through counseling. Also known as alcohol counseling, behavioral treatments invoke working with a health professional to identify and help change the behaviors that lead to heavy drinking. Behavioral treatments share certain features, which can include developing the skills needed to stop or reduce drinking, helping to build a strong social support system, working to set reachable goals, and coping with avoiding the triggers that might cause relapse. 3 medications are currently approved in the United States to help people stop or reduce their drinking and prevent relapse. They are prescribed by a primary care physician or other health professional. Some are surprised to learn that there are medications on the market approved to treat alcohol dependence. These medications work by offsetting changes in the brain caused by alcoholism. All approved medications are non-addictive and can be used alone or in combination with other forms of treatment. Alcoholics Anonymous and other 12-step programs provide peer support for people quitting or cutting back on their drinking. Combined with treatment led by health professionals, mutual support groups can offer a valuable added layer of support. Due to the anonymous nature of mutual support groups, it is difficult for researchers to determine their success rates compared with those led by other health professionals. I would like to thank you for listening to the duration of my presentation, and please contact me if you have any questions. Thank you very much.